let's take a look at the lower leg. And usually they just call it the leg, and then the upper leg they call the thigh. So right here, let's take a look at the lower leg, or leg and the foot region and the anterior view. And again, like we mentioned in the last couple of slides and the last couple of videos, keep in mind, in anatomical position, your legs, all of the muscles that are found in the anterior part, those are all extensors. So your quadriceps, biggest muscles in your body, they're found in the anterior part of your legs, so your thigh. So what happens is they're all going to be, when they contract, they're going to extend your knee. All the muscles here on the anterior side of your lower leg are all going to extend your foot or your toes. So let's take a look at some of these right here as we kind of go through and remove some of the muscles and the skin. And what we'll notice is that on the skin right here, I'm trying to make it a little bit less bright, right? And probably the easiest thing I want you to do is, right, feel where your shin is. When you feel where your shin and your shin bone are, and I want you to move, once you feel the shin, move your foot upwards. As you move your foot upwards, you'll notice a muscle on the outer edge of it that's slightly lateral to that shin. That's this muscle right here. Again, this is medial, this is lateral. So this muscle is immediately lateral to the shin bone. So this is actually the muscle that gets really inflamed when you get shin splints. This is your tibialis anterior muscle right here. And it's right next to the shin. So again, move your foot up and down. As you touch your shin, you'll feel that thick muscle immediately lateral to it. That is your anterior tibialis. Next to it, you see a muscle that goes all the way down. As it goes down, it goes all the way down into the foot area right here. So that muscle, as it goes all the way down to the foot area right here, is going to move, not your foot, it's going to move your toes, right? So these is going to allow you to extend your toes as it contracts. That muscle starts way up here though. It starts way up here, immediately lateral to your tibialis anterior. This muscle is your extensor digitorum longus muscle. And again, when you hear longus, I want you to think brevis as well. So tib anterior, extensor digitorum longus. Now we do see the Peroneus Longus and Brevis, otherwise known as the Fibularis Longus and Brevis, but you can see it over here. That's a Fibularis Longus on the outside edge. And then the Fibularis Brevis usually starts a little bit lower down. Don't know if we can see it on this view. Hopefully we can see it better in the next few layers. As we remove the muscles deep inside right here, the main thing is they've removed all these muscles and you really don't see anything else except on the foot. On the foot, you start seeing the second muscles that we just kind of mentioned, right? Before we said you saw the extensor digitorum longus. Well, now these are on your foot itself. This is your extensor digitorum brevis. Now, unlike the hands, right? We can see that the longest muscles on the name of the longest muscles, when we're referring to the foot, usually the name of those muscles are named because the longest muscles are found away from the foot. They're usually found on the tibia or in the fibula. The brevis muscles, the shorter muscles, are actually found on the foot. So where I have my pointer, that's your extensor digitorum brevis muscle. Now that's about all we can see on this